So one of the things that we need to probably talk a little bit about is the different types of hormone therapies. At the end of the day, we produce our hormones from the food that we ingest. And then our body makes those hormones and uses them as they need it. And when we artificially or put them in there, we have two main types of hormones. One is what we call the synthetics one. Birth control pills is a estrogen-based synthetic, and that's why most doctors will recommend that you only use it for a certain period of time until a certain age, because that synthetic hormone needs to be broken down in the liver and can cause carcinogenic type products. Same thing with testosterone. You have a synthetic one, and you have what we call bioidentical. I like to use the word plant-based because it's the same chemical as what we get from a plant, and our body doesn't know the difference. So when we talk about bioidentical or plant-based hormones, we don't have the same risk as we do with synthetic. And with synthetics hormones, you have to limit how much you use and how long you want to use it. Yes, it comes a time in our life when we probably should not add hormones and when we get to a certain age, just because we're concerned about some of the heart problems and things like that. But in general, you can use bioidentical hormones late in life. Why don't you refresh us a little bit on the side effects of hormones?
Well, one thing I'm quick to tell patients about hormones is anything that has a list of benefits as long as hormones that looks too good to be true will also come with some set of possible side effects. You don't get that kind of potential benefit without any risks at all. It does sound too good to be true, but the reason that is the case is because they're hormones, and hormones are incredibly powerful. So it really is possible to improve your quality of life on all those different levels because we're talking about something so powerful as hormones. But again, with hormones, let's say with testosterone, some of the common side effects that we need to go over are possible facial hair with women and possible acne and things of that nature, most of which we are able to ameliorate with dose adjustment or frequency adjustment and things of that nature.
And every once in a while, we'll have a procedure complication. We like to use what's called the pellets, both for estrogen and testosterone, especially in men. Sometimes you can have, wherever you put it, you can have a little chance of infection or a little bit of bleeding, and even one of them can come out. Those are very rare, but like you said, we want to be upfront.
Yeah, the pellet insertion with bioidentical hormones has so many advantages because you're able to treat the hormone deficiency once every 3 months or once every 5 months. But it is a little more invasive than giving yourself a shot every week. And you have these risks that come along with that. By and large, though, very, very infrequent.
And then, we forgot to mention a little bit, you can use creams. Creams are cumbersome to use because you got to do it several times a day. And you can't hug anybody afterwards, and it's very unpredictable. So the idea of you using bioidentical hormones in a pellet form is that you get to the level that you want, and you stay there for 3 months or so for a female, in about 5 to 6 months for a man, and you don't feel the difference. We don't want this yo-yo that one day you feel good, and with shots, for example, one day you feel good, the next day you don't. We want you to have months of, this is my new norm, and that's what we like to hear from our patient. And then when they forget to do it, they realize, I forgot.